For those of you that don't know, American Cancer Society has Voice of Hope, and that is who our next presenter is coming to us by. It's Brenda Hoffer, and she is a survivor of breast cancer for 3 years now, and she's been gracious enough to share her story with us. So, Brenda Hoffer, thank you.
So, no long pedigree like the doctor has. My intro is, hi, I'm Bubba. Am I picking up in the mic? Okay. So, I'm going to cut right to the end of the story, why they call me Bubba. So, it started as a family nickname from my sister's little girl, my beloved niece, who couldn't say my real name, which is Brenda, and it came out Buh. And my very loving older sister embraced that because it made me sound just a little bit dim. Buh kind of rhymes with duh. And then it evolved into Bubba, and it was so fitting because I work in corrections. So there's actually a lot of Bubbas where I work. You know, some are on this side of the bars, some are on that side of the bars. But one thing all of us Bubbas have in common is, you know, we don't really back down to much. And a grown woman who embraces the nickname Bubba certainly does not shy away from the harsh realities of cancer. And in December of 2010, I went for a routine mammogram, and I was going about my business that day because as part of my employer's wellness program, we have an incentive to get our routine exams. And if we accomplish all of the things that are set out for us in a year, we get our premiums back, refunded to us for our health insurance premiums. So I know, how sweet is that, right? So I said, when there's money involved, I'll go for that mammogram. I know. Sorry, company. Somebody run that upstairs. So that morning I had my eye exam, and then that day after work I went for a routine mammogram. And the mammographer said, I think we need to retake that. I didn't think anything of it, so she retook it. And then she said, I think now we want to have an ultrasound. And then I kind of started to pay attention, and she said, well, I can't tell you what I see. Although I could see what she was seeing because I had just got my eyes checked. And I saw on that ultrasound what looked like a lump. And she said, we'll have to have the doctor come in and tell you what that is. So he came in. He was very kind and cautious and kind of pussyfooting around about it. And I said, look, doc, first of all, they call me Bubba, so just tell me. And I said, what you don't know is just 9 months ago, my adult daughter at the age of 29 had a malignant tumor this big removed from her salivary gland. And her cancer was so rare, it accounts for less than 2% of all the cancers. We struggled, we fought just to find somebody who would diagnose her, let alone treat her. And I said, doc, what you might be telling me could, worst case scenario, be breast cancer. And thanks to all the research done by the good doctor and folks and organizations like the American Cancer Society, if this is breast cancer we're talking about, there's going to be a roadmap for treatment and there's going to be a path to follow, and I'm going to be fine. So just tell me what you need me to do, and Bubba's going to go get her done. So I'm not going to lie to you, though. That night I went home. It was a cold, dark night in December. You know how it gets dark at like 5 o'clock when you get home from work and go, where'd the day go? And I went on the internet because Bubba knows there's all kinds of good stuff on the internet. But I was smart enough to go to a reputable source for information. And that night I went on the Cancer Society's website, cancer.org, and I found so many things that I didn't know, even just the diagram of the breast. I mean, I didn't remember any of that stuff, what a breast is made up of. And I learned different types of cancer, different kinds of treatment, some cancer myths. And I actually even learned how to tell my family about what I think I'm facing. And most importantly, that evening, I found comfort. So I had a lot of scans and a lot of biopsies, and it was determined that I had a malignant tumor in this side and LCIS in this side. So my team decided that I needed to have a bilateral, complete, and radical mastectomy, which I did, and I was lucky enough to be a candidate for reconstruction. Yeah, Bubba wears a Hawaiian shirt to a mastectomy. So sadly, though, my daughter went from being a survivor herself to becoming now my caregiver, and I went from being a caregiver to a survivor in less than 12 months' time. And I'll tell you, watching my daughter have to first face her own cancer and then face my cancer was probably the hardest part of that entire journey, because as a parent, you know, we'd rather suffer for our kids than anything else in this world. And ironically, right after her surgery, that threw me. And I had read my horoscope on my birthday. Her surgery was March. My mammogram was December, right smack in the middle, June 3rd, 2010. I read my horoscope in the newspaper, and I cut it out because it spoke to me. And I was like so lost from her cancer and so scared for the future. I cut it out, I saved it, I laminated it, which is so totally out of my character that you wouldn't even believe it. And I'm going to share a little bit of that. I know you can't read it on this slide, but I'll share what it says. This year, you will certainly discover the power of imagination, luck, and a willingness to transform. Well, fortunately, I had a willingness to be transformed. You also might be drawn to a particularly good cause of some sort. Well, at the time, I had no idea what that cause was going to be, but as it turns out, it was the American Cancer Society. The summer after my mastectomy, the summer of my mastectomy, I went to a support group meeting. The very first support group meeting I ever attended, this guest speaker was a young man named Brandon. And he was at the time an employee of the American Cancer Society. And he shared with us his personal story of his diagnosis of testicular cancer, and he used the same words that in my mind I was feeling. That cold, dark night when he got his diagnosis, he went home, and he also turned to the American Cancer Society, only he called the toll-free 800 number. And he spoke to a live person, and he found comfort that night. He also shared with a group of ladies that evening some other things that the Cancer Society offers: Look Good, Feel Better, Reach to Recovery, Hope Lodge, Patient Rides for Treatment. And he also very casually mentioned that there was a Making Strides Against Breast Cancer walk being held in Harrisburg coming up. And he said, if any of you ladies are interested, he had these brochures, and I think there's a supply in the back of the room. Yes. He said, take one if anybody wants to do the walk. So I took one, and I went home and I talked to my daughter about it. I said, hey, I think this might be my cause that my horoscope predicted. I think I'm gonna, do this. I said, let's start a team. I said, what should we call it? And she said, oh, Team Bubba. So that very first year, Team Bubba, we came right out of the gate. We were one of the top 10 fundraising teams, and that wasn't a corporate sponsored team. We were up there hanging with Harsco, though, and that was family and friends and well-intended people who knew breast cancer. And I was at a bank night, and I was goofing around, and I said, I'm here, I have all this money, I don't know what size shirt I need because everything's new. And they said, well, what's your name? And I said, oh, well, it's Brenda, but I'm registered as Bubba. And they're, wait, you're Bubba? We saw this new team. You're really not what we were expecting. I'm like, yeah, I'm a woman named Bubba. So they said, we want to know more of your story. Do you think you'd like to get more involved? And do you think, you'd be willing to share your story? So that cause that I was drawn to just got solidified. And, after all, it was written in the stars that I would be like that guy Brandon, standing up here in front of all of you, sharing very personal stories. That's what the Harrisburg Walk looks like, by the way. So as a result of my genetic testing, the following summer, 2012, I had a complete and radical hysterectomy for preventative reasons. And while I was out recuperating from that surgery, it was a great time to start my fundraising for Strides. And I got an automatic email that a new member had signed up for my team, and it kicked back to the staff partner saying I was out of the office recuperating from a medical procedure. She actually personally contacted me to inquire about my health and offered, is there anything she or the American Cancer Society could do to help me? And let me tell you something, folks. The American Cancer Society is very large, but it also is very small. And that is real people caring about real people right here in our community. So once again, the stars were right when they predicted my cause that I'd be so drawn to. At the suggestion of my oncologist, my daughter also had the genetic testing. Now, if we can all remember how genetics work, she had a 50-50 chance of carrying that gene. So can anybody guess what my already cancer surviving daughter, how her testing came back? Yeah, exactly. It was positive. But thanks to the medical knowledge that we have, people like Angelina Jolie, so publicly sharing her story, people understand the preventative life-saving surgeries that my daughter's facing. So, and that's part of why I like to share my story. So people usually say, well, how is your daughter? She's fine. She she had very successful surgery, which removed her tumor with what they call good margins. Her lymph nodes and scans have all been clear ever since. She just celebrated 4 years of being cancer-free. And she gave me permission to share this, but she said, don't leave it up long. So yeah, they peeled back half of her face. She's got this crazy scar. So this slide left blank intentionally. But here's what the good thing is. Our genetic testing results came back, and she said she was told by 35 or 40 at the latest she should start having those preventative surgeries. And for her, it was her ovaries first, and then maybe the prophylactic mastectomy. So she says to the boyfriend, if we're going to do this, then we need to get serious. So he stepped up his game plan. He put a ring on it. In September, they got married. It was my privilege to walk her down the aisle. On Christmas Day, just this past Christmas, she announced to me and the whole family that they were expecting a baby. So you can do math. So the baby's already here. 2 months ago, my beautiful grandson, I know, right? How awesome is that? My beautiful grandson was born, and his name is Grant. And I actually feel like he is a wish that has been granted because he is beautiful. Now, I wanted her to have a girl, and I wanted to name it Hope, but, you know, life's not neat and tidy like that. But here's where I want to share something really, really personal with this group, and this is something I've not even shared. My mother doesn't even know this, so if anybody here knows my mother, I was 48 years old when I went for that mammogram. That was only the second one I ever had in my entire life. They say at 40, have them every year. But I was one of those people that I felt fine, my health was good, all my levels were good. I only went because my employer was going to give me back the money for my health care premiums. And I'm so glad I did. And so I call that sadder but wiser. And I can't even tell you why I put it off other than it's not me. And there's so much, everybody always goes, but it doesn't run in our family. But as the doctor just shared with us, that running in the family is such a very small number that our biggest risk for breast cancer is being female. And the other thing I didn't understand is on that very first mammogram, they did tell me I had dense breast tissue, but I didn't know what that meant, and we didn't have that legislation then, so much wasn't known about it, and I was ignorant to it. I ignored it. So I did put together a little educational component because it is lunch and learn, but the doctor's already covered it. So I'm going to flip through. I'm just going to skip past. This is all there's a 2-page handout on cancer.org about dense breast tissue. If anybody's interested in it, it's a really nice resource to have. And it talks about what the legislation is. And there's some other guidelines on the cancer societies about good breast health. I'm going to leave that up for a second. And I'd just like to share with this group that routine mammogram, I really do truly believe saved my life. And had I gone earlier, it might have been detected sooner, and I would have not have had to have such drastic treatment. So I did learn my lesson, though, because when I turned 50, one of my biggest gifts I received was from my family doctor, and my gift was a prescription for a routine colonoscopy. Anybody? Oh, I see somebody back there going, oh, you got the same gift. And I said, oh, and he said, don't you even. And I said, okay, I'll go. And guess what they found on my routine colonoscopy? No, that's where you're all wrong. They found a perfectly clear, healthy colon and whatever else they looked at. I know, right? And the doctor actually said, you know, it's about time you caught a break. And I said, yeah, but I'm glad I got it because now I know, and now I don't have to wonder about it. So if I can emphasize one thing enough, it's know good breast health, follow all those things we've all been taught and told to do, and get those preventative exams because they really do save lives. And, you know, my sister likes to say there's a Bubba in every family. And, you know, if Bubba can do it, everybody else can do it. Go get those exams. And if any of you know a Bubba in your family or If you don't, maybe you are the Bubba. I'd love to meet you. I'm going to be sticking around here. I know you guys have to get back to work, but that's what the Stride starting line looks like. And some of these people are my team members in this picture. That's where we always start. We always start right at the front. And that's, oops, aw. That's what I'll look like, only this year I'll be pushing a stroller. And if you want to sign up, and if you don't have a team, you're welcome to join my team, join my family and crew walking, and get your preventative exams. Thank you very much.